Hi, this is Dr. Duresti with the Cranial Release Technique. Back with some other videos, some questions that I received from practitioners throughout the country and the world. And I just want to follow up. Remember the last time we spoke, I discussed about balloons in the nose and how the cranial release technique does not use balloons in the nose, but there are other techniques that do use balloons. And again, I don't really know much about it, so I don't want to comment positive or negative. I stick to what I know and what I do best, which is cranial release. So we'll stick to that. The main question that keeps coming up is, what about children and the cranial release technique? Can you do this to children? Is there any reason why you would want to do this to children? The benefits of doing this to children. So let's just review for a moment. So here's a plastic model of a fetal skull. And as the baby's head is passing through mom's birth canal, the cranial bones are getting compressed. Now, I was just recently reading an article, and it's the first time I've heard it, and I haven't verified it, but I believe it to be true. Humans are the only mammals where the fetal head is larger than the birth canal. So just think about that for a moment. In theory, that doesn't really make sense. But from a cranial release standpoint, and from a cranial standpoint, in some aspects, it does make sense. Because as the cranium passes through, and there's this major compression of the cranial bones as the head is passing through, well, that compression then leads to a decompression, or what we call in the cranial release technique and other cranial techniques, the kickstart, or the opening of the cranium. So with the plastic model, the Hoberman sphere, we have the baby's head in the womb, if you will, passing through the birth canal, compression, 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 exiting the birth canal, decompression, and that's what kickstarts this primary respiratory mechanism, this cranial pump, as some people call it. So that cranial pump is now activated, fully activated from the birth canal. That's normal, that's natural. Then you say, well, what about things like forceps, the vacuum extractor, C-sections? All those things, in my opinion, would negatively impact the normal blowout phenomenon that should happen, but that doesn't happen. And I'm not saying it's sometimes necessary. It is, to save the life of mom and the baby. I understand that. But in a perfect world, you have the normal compression, the decompression, that kickstarts the mechanism, and that leads the baby on, in theory, to a happy, healthy life. We need the cranium to be breathing, the primary respiratory mechanism. We need this to be optimized. We need the cranial bones balanced, aligned, optimized, and the motion optimized. In chiropractic and in most structural-based healthcares, we talk about structure determining function. If the structure is off, the function's off. So regardless of the baby's age, ideally give me the baby right after delivery. That's the perfect time to apply cranial release. And as I mentioned in other videos, even a step back would be while mommy is pregnant. Now, you say, wait a minute, how are you going to get to the baby while the baby's in the uterus? I'm not going to get to the baby directly, but I'm going to get to the baby through mom's cranium. When we balance mom's spine and pelvis, align the pelvis, you can go up to virtually any pregnant woman from the back, and if you just put your fingers on top of her pelvic bones, the iliac crest bones, you're probably going to see some sort of distortion. And that distortion tells me that the pelvis is misaligned, the birth canal is reduced. That's going to be a more difficult delivery for mom and the baby. So ideally, I want to get cranial release to mommy while she's pregnant. And if we take it back even a step further, we want to get cranial release to mommy and daddy before conception. And then when conception happens, mommy and daddy, and of course the baby's inside, all come for cranial release to maximize structure, maximize function, to build the health of the family in aspects that most people aren't even aware of. We think of staying healthy by eating and exercising and all those things that are all great. But to me, the missing link is the cranium, because the cranium houses the brain. The brain is the central nervous system. The central nervous system controls and coordinates all functions in the body. So to me, you can't be healthy, truly healthy, without having a cranium that's balanced, aligned, and moving normally. And that's what the cranial release technique is all about. So when you get time, please visit the Cranial Release Technique website. That's cranialrelease.com. One word, cranialrelease.com. There's a button there that you can click called Online Training Program. And you can click on that, and that will teach you, that will lead you to another page which will tell you all about the online training program, which is done in the comfort of your home or office. And if this is something that you're interested in, regardless of the type of practitioner that you are, if you're putting your hands on patients, the chiropractors, the therapists, the physical therapists, the occupational therapists, the dentists, the medical doctors, the osteopaths, if you haven't looked into cranial work, I would strongly recommend you take a look at the cranial release technique. Again, this is Dr. Duresti with the cranial release technique. Start looking at the cranium. Start thinking cranium when you're dealing with your patients. Regardless of what they're complaining about, there is a cranial component and a cranial distortion that's weakening the system, which we'll discuss more in future videos. Cranialrelease.com is the website, the online training program. You can subscribe to this YouTube channel. You can order a free report from the website. And I hope to hear from you down the line. Thanks so much. Dr. Duresti signing off. Adios, my friends.